Alright, hey guys, Lee here. It's December 4th of 2011, and I wanted to do a really quick video about being trans and dealing with health professionals, because it seems to be one of the most nerve-wracking things that any trans person has to do, because at that point, when you're in a doctor's office, there is no denying that you're trans, you know. It's not like going into a male bathroom, or it's not like going into into just a store and being able to, pass as a male or pass as a female. I mean, it's something where you actually have to lay everything bare. I mean, even if you've had top and bottom surgery, theoretically, the best thing for you to do is to report I'm sorry. There we go. Okay, so the best thing for you really to do so that your doctor can do what they're supposed to do, or any medical professional can do for you what they're supposed to do, is that you out yourself as trans. And in a weird way, because, as a trans person, you try so hard and for so long to get your validation as a male or a female that, when you have to go into a doctor's office or go into, like, any health setting for any particular reason whatsoever, whether it be to get your hormones, for a simple cold, if you're there for, like, your yearly checkup, there's things that, you have to out yourself. You have to out yourself, essentially. Or your other option is you go and tell a bunch of half stuff where they don't quite, understand, and then give you the wrong treatment. Or you just don't go at all, which I think is the worst thing you could possibly do. Recently, I got a message from someone asking me, like, because I work in the healthcare field, and they asked me things like, and the big question they had was, what do you do if you're trans and you're in a car accident, or something where, either you're not capable of speaking, or you're going to have somebody speak for you, so that, you get, like, the best medical care possible. And I know it sounds really weird, but essentially my answer to this person was, you have to out yourself. Simple as that. You out yourself. You say that you're trans, that you're male, that you're male to female, female to male, and if emergency medical services give you a look and that they don't understand, you have to break it down for them, because as much as we would like to think that everybody in the medical community is savvy and understands, like, the basic idea of what a transsexual is, they don't. I'm finding out, especially through work, that they don't. And not that you can really, I really don't blame the medical community, because they're, as advanced as they are in some areas, they're behind in others. Procedures and drugs and things like that. They're very, they're moving forward in things. But as far as bedside manner and, like, understanding of the person and treating, the concept of treating the whole person, it seems a little behind in some ways. And not that it's bad, it's just that it's different, and that I think the medical community needs to be, educated in some ways. My girlfriend started her residency, and one of the best things I think that could have happened was, in a weird way, and I mean, not only her graduating, because that's absolutely awesome, and I'm totally proud of her for that, but one of the best things that could have happened for her residency, for her fellow residents, was meeting me when it comes to dealing with transsexuals in the community, and doing it through their work, because they're all psychiatrists, or they're all doctors in the residency to be a psychiatrist. So I think one of the best things that could have happened was meeting me and meeting her, and having interactions with both of us, and seeing, that really, in the grand scheme of things, that they're, that we're not an intimidating group, that we pretty much strive for what everybody strives for, which is a happy life, and, but anyway, when I received the message from this person, I actually went and talked to an EMS worker, and I asked them, somehow or another, I don't even remember how the conversation navigated, but I ended up asking them straightforward that, if you arrive to a scene and you see, and the person says that there's a transsexual in need of assistance, blah, 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 what would you say, what would you do, what would your reaction be? And what this particular worker told me was that, I really don't care if they're a transsexual male or female, my job is to get them to the hospital and get them there safely, and so the doctors can do their job and help them. Now that's what this individual said, and I understand that there is, hang on. Okay, sorry. And I understand that there, that going, Dallas-Fort Worth area, which is still very conservative, but is nowhere near as conservative as East or far West Texas, that you're gonna get different treatment. I'm not saying that you're always, that by outing yourself you're always going to get the best treatment possible. But most cases with most health professionals is what they say is that, I don't care what you did, I don't care who you are. Really, in most cases, I just want to know what I need to know in order to give you the best care. And for the most part, the people that I work with, it's very true. But what seems to really get me is that, and I'm starting to become more aware of this the more people I talk to in the health field, is that they don't know, they don't understand. They don't understand what rationally they understand what a transsexual is, that they went from this gender to this gender. But they don't understand, there's certain things that I realize they don't get. First of all, they don't understand the effects that hormones can have on you. Because of Chaz Bono, and his coming out and everything, there's been a lot of talk about Chaz Bono within the community, within my workplace. And they don't understand things like where his breasts went. They think that the testosterone took him away when, in actuality, you have to have surgery to remove them. Not many people get that hormones have this wonderful ability to add things to a body, but not to subtract things. Such as, you cannot, subtract an Adam's apple. You cannot subtract breasts. You cannot subtract facial hair. You can only add those things. And they don't understand hormones, they don't understand the surgeries, they don't understand the whole process of going from one gender to another as far as the amount of legal work that you have to do. They don't understand the implications that you being trans or coming out can have on family and family members and on a relationship. And they don't understand how the pronoun usage and why that's so important. And it's not something where it's bad. It's just simply that they're realizing that they're very uneducated. And in many cases, and this was, I think, the most important thing I found out throughout this whole process, is that they are, in many cases, more scared and more nervous and afraid of looking like idiots than than other people. They just, nobody wants to look like they don't know things or that they're not world savvy, and so so in their mind, one of the worst things that can happen is that you're presented with this patient who's a transsexual and who is a female to male, which not many people know of. Many people are familiar with male with females, but not many the other way, and they don't, and they're like, okay, well, there's no breast. And that's what I'm realizing the big thing is that when identifying a patient, if they're male or female, the healthcare worker says, do they have breasts? And that's supposed to be the identifier as to whether they're male or female. And so they're just so nervous, and I think it's important for trans guys to realize this, because I don't know for sure. I would like to believe that most trans guys, have been able to find a trans-friendly primary care physician and have been able to do, know what they need to do in order to get proper medical care. But part of me in the back of my brain, that really big voice is telling me that there are people, there are trans men, there are trans women who have decided that going to a doctor is like one of the worst things that they could possibly do because they don't want to, out themselves in that way. And, personally, I would rather a person deal with, and I understand that, it's difficult. I get it. I really do. But I'd rather that person deal with a few minutes of annoyance and frustration at the medical field and get the care that they need, rather than suffering through and having, whatever it is develop into something worse, or decide not to go in and, get checked out because they're afraid that they're, I don't know, but that they're just afraid in general of the medical community, what the medical community is going to think of them. I have a trans female friend who goes to a trans-friendly doctor in my area. I don't go to that doctor, I go to a different one. But she was telling me about how she went and, she was familiar with the doctor, but the doctor had like an internist or a new physician assistant or something of that nature who wasn't familiar with my friend's story. And the doctor, she voiced her concern to the doctor, and the doctor said, you know what, it's just parts. All you have is just parts. You're human with just different parts. And, and I think in some ways that was the best description and the best way of viewing things that I could have possibly imagined. Because, really in actuality, when I think of it, and I know this is sort of like mystical or whatever, but I think the most important part of a human being is the soul, and the body is just a shell. But, and the medical community has to realize that, when you're treating a person, the body is just, cells and minerals and things of that nature combined in a certain form, but really the most important part of an individual is what's inside and not what's out. So that's really what I have to say. I was also hoping that this video can at least start a response section for guys that have had experiences within the medical community, because I am realizing that I need to start taking a little firmer hold with a couple connections that I do have, and trying to make things a little bit better. Where I went to school, my school was very, for medical assisting, it was a very interesting school and diverse school. And I was actually going to try to get back in touch with them to see if they wanted to have me, or at least offer my services to come back and talk on this topic of gender in the medical field, in hopes that there is that they will allow me to come back and speak on this, and maybe give some of them going into the medical community, the medical assistants anyway, that first person who you see when you walk in the door, whether, if it's male, whether, that starts the whole, if you're, your validation during the doctor's visit, and how you're going to be treated. It's that whole thing, first impression. So, that's all I wanted to say, but I was hoping that guys could give some feedback or some comments, and I hope everyone's doing good and having a good holiday season, and I'll talk to y'all soon.